Hello, I am Dr. Chandrika Shekhar, working as an obstetrician and gynecologist at Chirag Hospital, Bangalore, JP Nagar, second phase. I am also a visiting consultant, Malti Manipal Hospital in 9th block, Jayanagar, then Apollo Cradle Hospital in 5th block, Jayanagar, and Motherhood Hospital in Banashankari, second stage, as also Aster RV Hospital in JP Nagar, first phase. Coming to pelvic examination. Pelvic examination is the basic thing that a gynecologist does in her practice. Whenever a patient comes, we have to see what is the problem, and the problem will be invariably in the pelvis. So that is called as pelvic examination. So pelvic examination related to gynec of a lady is, we will examine the private parts of the lady. That is pelvic examination, we will see from the external to the interior. So externally we see what is known as the vulva. The vulva, what is there on the skin, then what is inside the vulva. Then after we cross the vulva, we will enter the vagina. Then vagina we enter, once we enter deeper into the vagina, inside we will see the cervix, that is the mouth of the uterus. Then after we see and watch these things, we will come to a conclusion. Then after doing that visual examination, again pelvic examination involves putting the speculum into the vagina and widening the gap so that we can visualize the things better. And after we remove the speculum, we further continue the pelvic examination by bimanual examination of the pelvis. In bimanual examination, we try to feel for the uterus bimanually. That is, one left hand is over the pubic symphysis, that is over the abdomen, and the right hand will be into the vagina. So we will see the structure in between our two hands, and then we will know the feeling what it is, and whether there is pain, whether there is a tenderness, whether the movements are tender, whether there is a feel of any mass, and the adjacent tissues to the uterus, that is the fallopian tubes and the ovaries. So when we feel through our both hands, we try to make out what we can feel in these ovaries and the fallopian tubes and the adjacent uterine organs. So that way we feel and try to diagnose the pathology. So that is what is called as pelvic examination.